All right. Good afternoon. I'm going to try that one more time. Good afternoon. There we go. All right, good afternoon. My name is Claude Jacob, and I serve as the Health Director at Metro Health, the San Antonio Metropolitan Health District. So I have the esteemed honor to be your moderator for this session. So, again, greetings again, and welcome to the 7th Annual Pathways to Hope Conference. I will serve as your workshop moderator, again, Claude Jacob, and a welcome to everyone, and let us get started with a little housekeeping. If you are attending the conference to receive continued education units, or CEUs, please listen carefully. It is important. All registered attendees seeking CEUs must remain in the session for the entire duration. The sessions are approximately 75 minutes long, so 1.25 CEUs will be issued upon approval and in the areas of LPC, LMFT, social workers, and psychologists. Each attendee can qualify for a total of 4 CEU eligible workshops Friday through Saturday. A post-session survey is required. Again, post-session survey is required, as well as daily conference evaluation. We are really grateful to have the support of NAMI Texas and the Bexar County Recast Project for making these CEUs available. Again, all registered attendees seeking CEUs must remain in the session for the entire duration. So now, it's my pleasure to introduce the speaker panel for this afternoon. Yay! First of all, Retired Colonel Mary Garr is the President and CEO of Family Service, a nonprofit in San Antonio, Texas, which since 1903, over 100 years now, provides a broad array of services that work to empower individuals, transform families, and strengthen the health of communities by addressing the social determinants of health that directly impact people's lives based on where they live, learn, work, play, and age. Specifically, she and her team work upstream to prevent or mitigate life, community, and systemic effects that affect people's long-term health and life potential. She is an experienced leader with 3 decades of diverse roles in several industries, including healthcare, city management, nonprofits, and the military, and as CEO and COO. Her last 2 military assignments were in Texas, serving as the last garrison commander of Fort Sam Houston and Camp Bullis, leading her teams in providing all the infrastructure and support services for a small city, supporting mission readiness and quality of life while merging the garrison into Joint Base San Antonio and then standing up the San Antonio Military Health System as its chief operating officer, integrating and aligning Army and Air Force healthcare delivery in San Antonio. Over the course of her military career, she has served in a variety of command and staff positions both in the United States and overseas in hospital, academic, and operational assignments. Mary Garr graduated from Georgetown University with a degree in foreign studies and obtained a master's degree in health administration from Baylor University and strategic studies from the U.S. Army War College. Our second speaker is Mary Beth Fisk. Let's be clear, I'm the only one on stage not named Mary. Right? So, Mary Beth Fisk has more than 40 years of experience in the nonprofit sector as a visionary, executive, clinical research scientist, and community builder. Mary Beth founded and directed a nonprofit foundation, developed an international tissue donor bank, and authored numerous scientific and peer-reviewed journal articles. As an innovator and leader, Mary Beth has instituted new programs at the Ecumenical Center during the 10 years she has been the CEO and executive director there. She has initiated programs for veterans and victims of crime, as well as launching 2 new programs at the center. The Ecumenical Center has been chosen as the trauma-informed care certifying body for Bexar County and has chosen to lead the Youth Backbone Initiative, Center for Young Minds, investigating upstream solutions to the problems of youth mental health. Recently, Mary Beth was instrumental in launching the Uvalde response to the Robb Elementary mass shooting. It is my pleasure and honor to introduce these 2 panelists. I'll come back and serve as the moderator. Again, remember, this is a fun, festive session, but I also just want to say on behalf of the fantastic team at Metro Health how much we appreciate you participating in this conference. And now let me turn it over to Mary Garr.
Claude, thank you very much for the introduction, and thank you all for coming to attend our session today. We have a lot to talk about and hopefully keep this interactive as we go through our conversation. So first off, let's make sure the slides are up here. One of the things that we realized, with our work is, as Claude said, we're working to address those barriers in people's lives based on where they're born, raised, live, work, play, and age that can affect their long-term health outcomes, their quality of life, really how long they're going to be on this earth and what they're going to be able to do during that time. And we realize that so many people that are affected by barriers with social determinants of health are also affected by a lot of trauma in their lives too. It's working. So, with our families, before the pandemic, we were trying to help them address this question: how can you plan for your future when your own present looks so very bleak? And when the pandemic hit, what we realized was so many of our families that we served were losing jobs, losing income, losing family members because they were so hard hit. Families here, a lot of them were frontline workers and, lost their jobs. They didn't have access to technology or broadband in their homes. They were struggling to help their kids switch to online remote learning, which wasn't easy for them. They had pay-as-you-go phones, not, laptops or anything. They were struggling on so many different levels just to try to survive and get through the pandemic. But these were challenges that for so many existed way beforehand. When we think about looking towards the future, moving towards and beyond the pandemic, we have to understand, where do we all come from? What are our opportunities? What are those barriers and those risks that are out there? Because if we don't understand our present, our past, it's hard for us to understand where we're at today and how we can really plan for a future. And with that, you think about people, we're humans. Humans by nature are social creatures, which means we have to live and work and play together to survive. And during the pandemic, when so many people were now staying at home and struggling and not having access to social connections and feeling isolated and alienated and lonely, it was just that much harder for them to be able to come together, and try to overcome it. And when you're thinking about, overcoming things, we really at our basic levels all want the same things. We want to be happy. We want our kids to be healthy. We want to have opportunities for high quality education, to be able to graduate from school, go on to good job training or college, career development, raise our kids in safe neighborhoods, etc. But unfortunately, far too many people in our communities just don't have those opportunities, and they don't know how to do it on their own or know what a good normal could look like, as you probably work with so many folks that are struggling, not just mentally, but physically, socially, emotionally, and all those other pieces as well. How much of those challenges end up being intergenerational, passing on from one family, one generation to the next, and how do we work together to break those cycles of intergenerational poverty and domestic violence and substance abuse and lack of access to these opportunities? We all want to be able to support each other and not just, be able to find ways to thrive, but also just to be able to achieve life's basic opportunities out there. So on that, just wanted to give some, phrases right up front. What is health? And there's lots of ways to look at health. Downstream health, those are those effects that people are dealing with, again, based on where they have been born and raised and growing up, that can either put in opportunities for life success or put in a lot of hardships to their lives that can carry over. Upstream is where ideally we want to be working, so what can we do to help prevent those hardships and outcomes down the road? And that ties to policy changes, laws, the actual work that's going on, and the work that you all do that can lead to good or bad outcomes. So on that, as I mentioned right up front, health, a lot of people think of just the physical health and the mental health. But as you know, there's so many more aspects to what health really is. I list a few of them up here, and they all really intertwine. And health is all about individuals, but it's also health of families, and it definitely is about health of our communities. If we don't have strong individuals and strong, healthy families, it's hard to have thriving, healthy communities. So where does health really happen? You know, in the United States, the average person spends about 100 minutes a year seeing a healthcare provider. That's about 4 patient appointments. That's the average person. So if you're only seeing a patient or a client 100 minutes a year, how well can you really influence or impact their health? Where does health really happen? If you look at it, it's that other 525,000 minutes in our year that we spend. That's a lot of minutes. It's at home, it's at school, after school for kids, wherever they might be, and work settings. That's where health is happening. So that means that's where health is influenced, whether it's the physical or the mental, the social, emotional, financial health, etc. Other health spaces, our grocery stores. You know, we all love our HEB, right?
Yes.
So we have our HEB, but you have transportation to get there. You don't have to worry about carting a couple kids along or worrying about, do you have funds to buy affordable, healthy food? You know, for many of our clients, if they don't have means to get there, they're going to go to, the Dollar General. It's a great place. But if you're buying your food there, what are we buying? Pretty much processed, unhealthy foods, but it's cheap and fills your kids' tummies. Or you're walking out to the local gas station or convenience store, also quick and fast, not cheap, but convenient for folks that don't have access otherwise. Do they live in safe outdoor spaces where they can feel comfortable getting out and getting to know their neighbors? So important for social emotional support. Do they take their kids to outdoor spaces and understand that importance of being outdoors, again, physically, mentally, emotionally, that's helpful? Or do they live in a neighborhood with stray dogs, drive-by shootings, gang activities, drug houses up the street? And I'm describing within a few blocks the community center that we run on the near west side. If you don't feel safe, you're not going to get out. You're not going to have your kids getting out also. Do families feel comfortable going out to find libraries or museums? Those are culturally and educationally enriching environments. Or do they feel that those really aren't there for them, that it's not part of what they are, or they won't feel welcome? How do we make sure we are all inclusive? And then obviously, churches or temples, synagogues, etc., big influences on health because they build trusting relationships, and then, other community-based organizations, etc. So in that, again, social determinants of health, those conditions and environments where people are born, raised, live, work, play, and age that can cause opportunities for life success, long-term health, etc. In the United States, too often, our lifespan and our health is tied to our zip code, not to how well we lead our own lives and take care of ourselves. It's tied to the zip code where we are born and raised and are living. And so when you're looking at opportunities for reducing barriers, creating opportunities for life success, what can you do in that space? Or do you see these kinds of issues? And I can tell you at Family Service, our clients deal with all these and more on a regular basis. So what can we be doing to break that cycle? When you're thinking about social determinants of health, there's a lot of definitions, a lot of different aspects to it. People, we talk about food insecurity or housing instability, etc. Those are facets of it. But when you're looking at the Department of Health and Human Services framework under the Healthy People model, they talk about 5 pillars here. And in there, many different facets, but here's a few listed that tie to these categories. Access to high quality education from really babies up through adult learning. Access to economic stability, whether it's tied to food, workforce development, housing, etc. Health and healthcare. Health literacy. Do you know what it means to be healthy? And do you have access to primary care, specialty care for yourselves, your children, etc.? And then having a strong, safe neighborhood and built environment, that infrastructure, whether it's access to transportation, safe, sidewalks, lighting, etc. Being in healthy homes, physically healthy homes, etc. Also, then that social and community engagement that is so critical to people's lives that help us to be able to feel included in society and to know where to access resources when we need help ourselves. So in there, going back to you've got to understand your past. Unfortunately, whether intentional or not, and it's been on both sides, we live with institutional bias in our systems. I list a few here, and even on the discrimination, it could be tied to racism, gender, religion, people with disabilities, etc. Systemic barriers are also in place for individuals, and I list a few of them up here too. And again, we think about every day how hard it is for folks that are living in their challenging times. This is what they're struggling with on a day-to-day basis. How do we work to come together to start breaking down those barriers, eliminating those barriers, and creating opportunities for those we serve? So this is our present, and that the present today gives opportunities, but also puts barriers in. That's again that original slide with social determinants of health. This is where we want to move to as a future. Look in these different categories. We want to create opportunities for access to stable food and stable housing, access to high quality education that leads to strong workforce development, college or career where you can now earn a living wage with benefits and not have all the stress tied with it, toxic stress, the stressors that can lead to substance abuse, domestic violence, etc. All these different pieces here. And then on that, when we're looking at how do we make change happen, this is a health pyramid. And in this pyramid, it's through the CDC, Centers for Disease Control. Broad change happens at the foundation of that pyramid, but it's hard to put in policies, ordinances, laws, regulations, etc. that can affect that systemic change. That red box there gives some examples of what we can do to make change happen systemically. The next higher box that talks about, changes on helping to make the easy choices, the default choices. For instance, wearing bicycle helmets, anti-tobacco campaigns, and trying to reduce opportunity, challenges. Even vaccines right now, we've got people on all ends of that spectrum, sadly. And then you go up, and at the top of the pyramid, you've got much smaller impact, intensive resources, more one-on-one. We want to be working on the foundational ones so we can have positive change for our broader society and population to create that long-term lasting impact for health. So another pyramid that I'm sure many of you are familiar with is our ACEs pyramid, and they go hand in hand, as you can imagine. That the base, a lot of it tied to historical trauma, institutional bias, etc. But at some point, whether that's a factor or not, trauma happens in children's lives. And then as you know, how does it move forward in terms of being toxic trauma or trauma that has some resiliency supports put in, ways to help move people beyond so they don't have those changes of either adopting those high-risk behaviors that they experienced growing up or struggling to now fit into society, having issues with their long-term health and early death as well. But these two pyramids go hand in hand. And anybody can be a victim of trauma growing up, as you know. But ACEs disproportionately affects those who are struggling with the barriers caused by social determinants of health in their lives. It disproportionately affects them, and they have access to fewer resources or understanding on how to adapt, cope, or overcome it and break that intergenerational cycle. So on there again, here's another slide that talks to it, another CDC slide, and just like with social determinants of health, unfortunately, they are going to be struggling with the same kinds of challenges with long-term effects on their health, chronic health conditions, challenges potentially with long-term behavior if they're adopting some of the same high-risk behaviors that then they'll pass on to their own next generation. And sadly, that loss of life potential, the what could have been. And they talk about that, again, depending on your zip code, you can see a 20-year difference in life expectancy. And when you're looking just here in Bexar County, anybody been to Government Canyon? Go see the dinosaur tracks out there and Cool Park and all that? Their life expectancy, according to a Bexar County report in 2019, before the pandemic, 89.2 years. Just a few miles away, over in Government Hill, close to Fort Sam, AT&T Center, St. Philip's College, as you know, it's an older, very poor neighborhood, not a lot of support, still struggling, 22 years less. Is that random? Or is it tied to the challenges, more affluent neighborhood, struggling neighborhood, and how do we work to overcome those institutional biases that have been baked in over our years here? So now, turn that up to pandemic issues. So people that have struggled with all of these challenges over time, when the pandemic hit San Antonio, Bexar County, and we serve actually across 14 counties, overnight we were having so many families that if they had jobs already were losing their jobs, having reduced work hours, being very hard hit by the pandemic and before the vaccine and then even after the vaccine with all the misinformation about what would and wouldn't work. But a lot of these were folks who had chronic health issues already, also disproportionately affected by the effects of the pandemic. So losing family members or dealing with long-haul COVID, kids struggling in their homes with school, parents or caregivers trying to find ways to get into the workforce, worries about losing their wherever they were living, food insecurity, etc. So we were having to continue doing all the underlying supports because we don't want them to get back to the normal they had before the pandemic. It wasn't a good normal for too many of them. It's how to help them to keep moving forward beyond the pandemic to a better normal, but at the same time realizing we now had to pivot to do a lot of immediate needs just to help them get through today while helping them realize that tomorrow could be better and move and help them down the road. But what we saw with this also, we also realized we had to keep our doors physically open. We had kids who did not have a stable home environment. When the school shut down and that was their stable daytime environment, where were they going to go? So we had to remain open. We had families and children, whole families coming in because they didn't have a way to access the remote learning at home. So we were helping them in there. And even if they could, a lot of them were struggling just to figure out how to do it, especially if they had more than one child. We needed to be able to help them. And with our computer lab, being able to help people, look for new jobs, do some job training opportunities. They had to be able to hold themselves together while dealing with the stresses and still trying to move forward. We also realized for our behavioral health programs, we also had to remain open. We could not just convert to telehealth because for too many, that wasn't going to work for them. Either they didn't want it or their needs were more intense than what that could provide, and they needed that face-to-face contact. So we added in remote learning and telehealth, etc., but so much of our work remained open and face-to-face. These are just a few examples of some of the immediate needs that we were trying to help stabilize our families with, what we were working to strengthen them going beyond that. But for us, again, when we look at the pandemic and the effects here, you think about, we almost had two whole different pandemics depending on where you were coming from. We had one pandemic where folks were able to now work from home, support their kids with remote online learning, deal with some of the social emotional learning impacts, and we understand that isolation and all those challenges that schools are now and families still struggling with. But for the most part, they were financially stable and able to adapt and adjust. And then we had the whole other pandemic for those, again, that lost jobs, lost family members, significant numbers, really struggled. These kids have fallen behind in school. Kids have dropped out of school because they needed to help earn an income for their families. And sadly, some of them feel it's easier now to work in a fast food place with no benefits as opposed to staying in school and trying to get into solid career development afterwards. And so those folks are still struggling with basic needs and are not thinking beyond that pandemic yet because it has been such a challenge for them. So what we have to understand is, realizing that we're dealing with different populations here that have been so affected by the pandemic or still affected. We've got so many that feel the pandemic's really in the rearview mirror, which would be nice. We know it's endemic now, but others, this has affected them for an entire generation, not just educationally, but physically, mentally, emotionally, etc. And we've got to come together to find that. And when you look at this, two children at different paths. One gets all sorts of the supports that we would want to have for a child, from early child education, nurturing family supports, strengthening the supports in the schools, able to finish high school, go on to college or career training, and then create a nice, healthy, stable life with a future for him or her and his future family, and then live into happy old age. Then the other child could have lived next door to that same one, didn't get any of these kinds of supports, and so not ready to start kindergarten, struggling to read in 3rd grade, dropping out of high school potentially, or squeaking by but no real solid skills to do workforce development, struggling with relationships, ends up potentially, again, following those same high-risk behaviors that he or she was exposed to growing up, maybe has a few kids along the way also, that now in that same cycle, we did not break that cycle, and then that person has long-term health issues. If they're alive at 40, 50, 60, they are not healthy, and too often they don't even make it to that point, and their quality of life has been lost. So with that, we can see ourselves, do we want to be in, thriving, healthy, resilient communities, or do we want to be in toxic communities? And that's where we all have to work to come together to be able to address what really are community challenges, community issues, And there's lots of needs that go into this, a lot of ways to come together. It's not easy, but this is how we're going to work to overcome, the mental and emotional challenges that affect the whole fabric of our communities that we all live and work in. And that was it on mine, and I'm going to turn it over to Mary Beth now.
Thank you, Mary. What a hard act to follow. I'm humbled to be with you today with my colleagues on stage, and thank you for working the electronic component. So what I'd like to share with you all today are 3 of the objectives of our time together, and that is talking about what the impact of COVID was in our communities. I won't spend a lot of time on that because you all know we've all walked this trauma together. Also to talk about some of the strategies that were employed during COVID and beyond, some of the things that we've put into place because of the trauma that's been experienced. And then also talk about effective ways to build resilient communities and how self-care is a big part of that whole process. So if you would describe the impact COVID has had, let's take a look at those statistics. Again, I'm going to briefly run through those because we're all very familiar as our mental health professionals have made sure that we have the latest and greatest numbers. But just as a quick point of reference, these are stats that were published as of the 22nd of August in preparation for this presentation. We've had 621,727 reported cases of COVID in our community. We've had over 5,000 deaths in the community. We know that vaccinations are part of the solution. 77% of our population is now vaccinated, but still 40% remains unvaccinated. And then looking at weekly reports, as we've heard our professionals, our elected officials share with us through this journey of COVID, the progression of active reported cases. And then very similar to what Mary talked about, with looking at zip codes and looking at how the prevalence of COVID may vary from zip code to zip code. So I'd like to start by talking about 6 foundations of community resilience. 1 being people. This sounds very familiar to one of our plenary session speakers that talked earlier today. Really the provision of power and the future of the community and can be built on its resilience and how we will go on, but community is a huge part of that. And then systems thinking, really thinking a little bit differently, not just to kind of random thoughts and random opportunities, but looking at the way systems can essentially find an understanding or a solution to complex problems which are unfolding before us every day. The 3rd foundation is adaptability. And that really brings us to, as a community, how can we adapt to those changes that come every single day? We certainly saw huge changes with COVID and the restrictions and the isolation and so many other parts that have already been described that affected our community. And then how can we transform? So from the challenges being so big, as big as they are, how can a community, a diverse community, adapt from a fundamental, transformative way in making our community a healthier place to be? And then lastly, sustainability. We can make changes, but are we able to sustain those changes in building the resilient community? We have to be able to work together. We have to think about our future generations. What's it going to be like for my sons or for my grandchildren in the future? And then our ecosystems, and our ecosystems are very complex. So I'm sure in the room today there are many people working in different spaces within this. And then lastly, courage. So if you look at a foundation of resilient community, it does take courage to be able to confront challenges, to take responsibility, and then collectively looking towards the future. So if we look at the impact of the country and early COVID strategies, and specific our San Antonio and greater San Antonio area, One phrase I'd like to share with you is security measures required to prevent the spread of the virus includes social distancing. We experienced that, didn't we? Lockdown, isolation, and quarantine for those that may have the virus or may have been exposed to the virus. From a work community, I can say that probably all of us, how about a show of hands, were affected in the workplace. Whether you're doing testing, serial testing, whether you had been exposed and had to limit your time together. And that brought about changes we were not accustomed to. You know, children, parents with children, and how they really, these kiddos who are used to being very social and moving, which is healthy. We know exercise and being active is healthy. Many cases they were trapped indoors. There was lots of efforts from our community leaders to say, get out and exercise in a safe place. Well, we found this experience to be pretty overwhelming and exhausting. I think for all of us, we could all agree to that. Other impacts, we had many migrant workers that were deprived of their work and daily income and had difficulties returning to their places of origin. Travel was a challenge. And the consequences of the economy widened and the social economic disparities continued to divide our country. As Mary had spoken to the joblessness and the fact that many people were not gainfully employed during this time because they depended upon many industries that were halted because of the necessary changes due to COVID. So we know that life really did, in many cases, for many people, come to a standstill. And we had a feeling of being lost. Our frontline workers, like our hospital workers, our doctors and our nurses, and even our law enforcement professionals, we referred to them as our heroes because they kept doing the job that they were tasked with doing. Essential service providers such as cleaning came to the forefront. We needed to make sure that we had clean spaces to go into and that we did everything in our power to ensure the health and safety for those areas. And then breaking barriers came every day. Many of them contracted, for those who were serving, contracted the disease, the virus, and some unfortunately perished. So if you look at this diagram on the slide, you'll see what I call my tangled ball of grief. It has in it many different aspects, and that includes things like sadness and anger, guilt, worry, emptiness, jealousy in some cases, right? It affected my family member this way, did not affect your family member that way. Those are human emotions that we know are all tied up into the grief experience. I'd like to shift for just a second and share with you some of the strategies that the Ecumenical Center, the organization I represent, put into place during these years of COVID, these many months. So we know that being isolated, we know that not being able to socialize with others is that's a human need that we have. And so for an organization like ours who focuses on counseling, on support groups, on being able to be with others, mental and behavioral health, there needed to be some modifications in order to deliver these services. So of course, like many other organizations in our community, we were able to shift to phone counseling and telecounseling. Sometimes, though, not enough for many of our folks who struggle. So we did maintain an in-person counseling approach for those that were struggling at the height of the pandemic. Everything was delivered in a trauma-informed way, which was a very critical piece. And if you look across this slide in the continuum, you'll see that there were 6 key principles that were employed, and that is safety. First and foremost, safety. How can we ensure the safety of the individual coming in? How can we ensure the safety of our staff, professional staff? Is there trust? Is there peer support? Is there collaboration and mutuality along with empowerment, choice, and voice? And then cultural aspects as well. Are we sensitive to the various cultural aspects within a community? So I'm going to give just a couple of quick examples. So for our seniors and locked in their homes, many of them, their real touch beyond their television or their telephone was to have a meal delivered to them through Meals on Wheels. So one thing that we felt very important, because the stigma of mental illness is still something that is with us in part. It's getting better, I'm glad to report. But for some of our seniors, that was still a potential problem, so we changed our vocabulary. Instead of saying, let's have a counseling session, let's have a session to talk about your mental health, we said, let's just have a conversation, right? Let's talk about wellness. And so the flyer that you see on the slide in front of you right now was distributed via Meals on Wheels to our seniors. And for those we had addresses, we did that. For electronic media, it was shared as well. And certainly for our students who were going through many changes and their families, there was the same invitation, but just kind of geared towards what they may relate to. So this little card talked about, dear friends, let's have a conversation. And that was done largely by phone or by Zoom in many cases. Partnerships with multiple different locations throughout our community was also important. If I lived on the southeast side of San Antonio, what's the nearest place I can go to get the help I need? And making sure that we had an opportunity for them to be able to access the care where they work, where they live, and where they play was critically important. Because transportation, as we know, can be a significant barrier. With our hospital staff, with those who were working back-to-back shifts, very difficult for them to get home and take care of their own families. We offered debriefing sessions, so setting up in a clean area of the hospital, being able to work with them, talk to them about journaling, how can they deal with the emotions that they're feeling, and be available in their space, but do it in a safe way, was another aspect of the program, which continues today. The second half of that was to be able to take and look at what relaxes us. What's some self-care that we can do for each other? And one of those things for many people is music. So we took a solo musician and planted them on the nursing units or in the lobby. And that was specifically for the staff, but also some of the patients had the benefit of having that relaxing environment as well. Journaling and processing. We've developed some new tools for that were very helpful and continue to be used today in both English and Spanish for our healthcare workers, or now for our teachers as well, as they're entering this next phase of starting back to school after we had such a tragedy occur on May 24th. It's brought about many additional anxieties. So our school outreach is definitely an important piece for all of us that work in this particular arena. Being able to be there for the teachers, the counselors, the staff, and then of course also our students, and helping to augment the resources that the schools themselves provide on a continual basis. Our presentation today wouldn't be complete without talking about self-care. So here's a few reminders for each of us. What are some of those effective practices of self-care? First, really look at the current situation as a challenge and an opportunity. The opportunity is the operative word there. Talk with your children if you have young children. Talk with your adult children. Communicate with each other. Stay connected to other people. And this is particularly of interest and necessity for those of us who have lost our partner, who may be isolated in our homes. Validate your feelings. Recognize you're not alone. Recognize that others are having those same feelings. And then seek out accurate information. Let's get the facts. Let's understand the facts so that we can offset fears. And then maintain routines. Create a routine. For many of our families who are now at home doing instructional work via means, we said create a new routine. Make sure you keep it consistent for your children. It's true for us adults as well. Limit media exposure and practice positive thinking, taking care of yourself, and seek to help others that may need help as well. So just one or two other things I'll share with you. We talked a little bit about the community response, not only bringing relaxation into the hospitals, but in other parts of our communities. as my colleague mentioned earlier, looking for those job opportunities, looking for higher wages, looking for a more pleasing schedule. Those are the things we're seeing as people come back to work. And of course, childcare costs also are a barrier in many cases. We also know that the fear that COVID has brought about is real, and we need to look at significantly reducing the results from the freedom to travel. We're seeing more of that now. I think more people have traveled this summer, perhaps than many other months prior to that. And then know that counseling is available so that we can alleviate those fears as well. I'll leave you with a chart which is referenced on the slide. And basically, this is a chart that looks at building community resilience, a process of assessment and readiness. It identifies that the adverse childhood experiences are definitely a factor, but if you'll look with me as we look at the slide in front of you, it's a shared understanding. It's a state of readiness. It's cross-section partners. How can we work together to make a better experience for all of us? And it's an engaged community. I think we're going to find as we go through the rest of our conference today and tomorrow that many of these same messages are being delivered. As a community, we can be stronger. Working together, we can be stronger. So, lastly, the goal is that redesign, aligning health and social service delivery systems to improve the fabric of our communities and really to those who are most vulnerable when we talk about equity. And then the important tactic is to actively engage and empower adults, parents, children to buffer the toxins that do exist in communities, and we will certainly all, we believe, be healthier for that. So I'll stop right there and turn it back over to our moderator.
Perfect. First of all, let's give another round of applause to our fantastic presenters. Just a gentle reminder again for this session on the collective impact, traumatic impact of COVID-19 on our community. I mentioned this at the outset. I just want to remind those of you that are attending that all registered attendees seeking CEUs must remain in the session for the entire duration. This is lasting 75 minutes. There is a post-session survey which is required. And again, we are grateful to have the support of NAMI, Texas, and the Bexar County Recast Project for making these CEUs available. So with that, we heard, kicked off, Mary Garr shared with us frameworks. Mary Garr from Family Service shared with us about frameworks, national frameworks, and the factors that shape a successful future. A lot of the context of what we've seen tied to this ongoing disruption anchored to COVID, there's a tone of familiarity because a lot of these conditions we've been seeing, but they've been exacerbated through this disruption, not just here locally, but around the globe. So with that, we also heard from Mary Beth Fisk, who zoomed out to help us at least be familiar with the resources at the Ecumenical Center, but also talking about what we see tied to COVID. So just putting numbers into context, you saw on the slide, and I just want to at least acknowledge from our vantage point, when we hear these numbers, over 600,000 that we know of that have contracted this virus. How many of you have been to the Alamo Dome? Okay, so if you can only imagine, the Alamo Dome filled the capacity not once, not twice, but over 8 times. That's what we're talking about in terms of the number of cases that have been reported to Metro Health, to our local health department. And when we hear about over 5,300 fatalities, just know that as one of the largest employers here in the city of San Antonio, so the city of San Antonio, we have over 13,000 employees. So if you imagine that over a third of that as fatalities. So just to put into context the numbers, and behind the numbers, we know that there are stories. And so I wanted to kick it off. This is the audience participation part of our session this afternoon. I do see the duo in the audience, and I just want to make sure that the microphones, or however it is that we can make sure that folks can ask their questions. So let me kick it off to ask a question to our esteemed panelists. Given what we heard this afternoon and given the context of this conference, so what do you see to be the key aspects of the social determinants of health that require better alignment to support those suffering from mental illness?
So, for those suffering from mental illness, when we're thinking of social determinants of health issues, too many folks suffering from mental illness, are struggling to access resources. And if they have a family support network that can assist, that's wonderful. Too often then the families are stressed in trying to meet those needs. And then too many also, are struggling alone as well, whichever population source they're coming from. So, if they're struggling with mental illness, and depending at what point it started in their lives, was it in childhood, with toxic stress, and then it developed and was diagnosed or undiagnosed, so they're already starting off behind in trying to integrate comfortably with a support structure. And then if they're struggling now with poverty, too often then less access to resources, and we know that our mental health resources are insufficient to meet the needs of those suffering from mental illness. So we see too often our prison systems becoming de facto mental hospitals when we know they're not equipped to it. We see the revolving door of people suffering from mental illness on the street, getting picked up, then back on the street far too quickly. So, every single social determinant of health is a huge barrier for them, from food insecurity, that housing instability, not able to work, if they aren't able to be supported, not having that social community fabric to support them, and then everything else that is going to affect them. And if they are suffering from mental illness without the supports, they're going to end up having physical issues, some may already, and then the other pieces of the health too. So it's how to bring those different components together that can wrap around those suffering from mental illness, so they can have a framework that will help give them opportunities to address their needs in a safe, secure way that can help them within their challenges and limitations to be able to live the fullest, healthiest life possible.
Thank you. Mary, did you want to add anything?
Well, just to say that social determinants of health, of course, affect everyone, especially when someone is suffering from an illness. And mental illness is no different than hypertension or heart disease, and we know that. And we help collectively to ensure there's an understanding of that. And I think all too often we may not make the mark, as we've heard throughout the day thus far, and I'm sure we'll continue to, that we need to prioritize mental health. We need to have an acceptance that it is something that we embrace and that we care and that we put our resources behind.
Just to add quickly too, and you all know this so well, many in our population confuse mental health with behavioral health challenges, and a lot of times, especially children growing up with toxic stress and adversity in their home, are sometimes diagnosed with mental health issues when they're really behavioral health challenges based on the stressful environments they're in. So it's also from that social determinants of health spectrum, understanding those needs and supports to help the children deal with the behavioral health challenges that they are exhibiting as a really just trying to survive in their environments, and help them to, and their families and the education system, etc., and healthcare system, to be able to understand that, so that these children can receive those coping supports and mechanisms, so they can adapt in a healthy, constructive way, as opposed to trying to adapt in what they're living in that toxicity. So that all interrelates too.
Thank you. As I was thinking about your comments, you reminded me from your presentations, the phrase about place matters, or zip code. The fact that your zip code determining your life expectancy, that shouldn't be. One of the things that we learned over the course of this experience tied to COVID is that these patterns that we've seen across the city or across the county, those patterns have not changed. As a matter of fact, we were forced to zero in and understand what's happening in those neighborhoods, especially east, west, and south parts of the city. And so, at the end of the day, we know that these conditions have worsened tied to this ongoing disruption tied to COVID-19. But it's also an opportunity for us to re-engineer and reimagine what else we could do a little differently to be more intentional in helping folks to get through this experience and beyond. So with that, why do you feel that it's important to shape a culture that was trauma-informed? Again, there's a lot of talk about that and being more intentional. So why do you think that's important, given what we know around the impact of these conditions that impact the quality of life of all those who live, learn, work, and play here in the city?
I certainly. The county of Garr has worked together collectively to create the South Texas Trauma Informed Consortium, which is a collection of over 600 different organizations that understand that we have all, over a lifetime, experienced trauma. And it's how we experience trauma and then how we respond to it that we need to be sensitive to. But as individuals, as organizations, we can do a better job of employing trauma-informed practices. What does that include? It includes safety. It includes being trustworthy, mutuality, as well as culture, understanding, and equity, being surrounding the entire scope of becoming a trauma-informed city, trauma-informed county, a trauma-informed state, and a trauma-informed nation.
And Mayor Beth said that so well, so I would just add that, if you're thinking as an individual, you get up, you start your day, you're going somewhere, maybe it's to the gas station, maybe it's to HEB, obviously to work, to school, are these environments welcoming environments that are trauma-informed? Everybody has had trauma in their lives at some point, and the ACEs tool that's out there, and when you're thinking about how do people respond to trauma, are people dealing with that toxic stress? And how well, when we think about mental health, it's not like physical health where you can tell, if you're an amputee or, if there's some physical thing that's visible, people will reach out and help. But too often with mental health challenges, it's not so visible. And if people are behaving with what is considered inappropriately, it may be actually a response tied to their trauma, and it's how do we make sure we are assuming that people are dealing with trauma. I say it's like having a bad day. If we just assume everybody is coming from a good place, how do we work to support that individual? Do we have the warm welcoming signs, the calming venues for people that could be triggered by that stress and that trauma? And that, again, it could be the HEB, it could be the work environment in the schools, the counseling offices. Are you trauma-informed in your practices where when people come in, they feel that this is a safe space for them to be able to start addressing and dealing with their trauma? Are they going to always be, on the edge of their seats, ready to run or ready to lash out because they are so uncomfortable? That's when we're talking about, understanding trauma affects all of us. We just have to, it's like putting on the glasses and starting to see things that we didn't know existed. We have to just be really cognizant that it's all around us, and how do we work to address it? Just like how do we work to address all these systemic issues with social determinants of health? When you start seeing it, it's like putting on a new pair of glasses and you don't even realize that things existed before, but now you see them in a whole new way.
Well, thank you for reminding us that yes, the trauma that we're experiencing collectively, that it impacts all of us. A lot of the narrative of what we tried to message over the course of the last year and a half in terms of protecting oneself and their loved ones, in terms of getting vaccinated or booster shots for COVID-19, is realizing that personal decisions do have collective or community impact. So at the end of the day, we're talking about trauma, we're talking about strategies, and we're talking about being more intentional. And so I'm interested to hear from either of you in terms of what you see. What do you see to be the areas of highest need through this ongoing disruption tied not only to COVID-19, but any emerging public health issues? Again, now, these days, we're talking about MPV or monkeypox or any other concerns that may be surfacing. So any thoughts about areas of highest need and what you see given your lens and expertise?
One of the things I would say right up front is health literacy is so critical. And it's not really taught or understood, the average person. We go about our daily lives and we assume that the systems are in place for us to, be safe in our homes, be safe going to work or school, that our kids will be safe in school, that, We will have the groceries we need when we need them, or, whatever else it is. But, sometimes we take that for granted. And public health in our country is taken for granted. Critical component to keeping us healthy as individuals, as families, as communities. But it runs in the background. When things are going well, we don't pay attention, unfortunately. And so much underfunding of public health has been occurring in our nation for years, as you know, and now we're paying the price for it. And unfortunately also, we love technology. We love that people can learn so much with the internet and everything. But another challenge is there's so much out there, and when people don't have strong thinking through, the critical thinking skills aspects, and young people in particular, we don't teach critical thinking very well, or as well as we could, they're struggling to figure out who to believe and what to believe. And if they're more likely to believe a stranger on the internet as opposed to their physician, their pediatrician for their child, or their doctor neighbor or somebody, or they're going to believe somebody else on the street, or their neighbor because they've read it somewhere too. We have a whole community, a whole society that is now doing this and arguing about what is right for our health. Vaccinations, for those, 100 plus years ago, when kids were dying of measles, mumps, rubella, diphtheria, typhoid, people, having huge challenges with polio and being, invalids and everything. We don't remember that in our collective consciousness today, and now everybody is saying, oh, we don't need vaccines. Vaccines are not a good thing. COVID vaccine, wherever you're out on the spectrum for it, we have people who believe in it, people who don't, and everything in between. But that affects our community public health, which then undermines our ability to be healthy at all different levels. So we've got to find ways to work through, to better understand what is health, the health literacy aspects, be able to parse through the variations of opinions, separating science and fact versus ideas. And that's hard. It's hard in today's world to be able to do that. I don't see a good answer, but part of it, I think, is coming together, bringing together people with different ideas and opinions and helping to find the common ground to figure out, well, why are people thinking this and thinking that and thinking that? We've got to find ways now to say, what can we do to help us as a community? And if we put our communities first, our families first, our children first, what does that really mean? And that's hard. So, but we have to do it. We can't ignore it, and we can't engage in the othering where we're suspicious and afraid of others. People are different from us. We have to really understand that we are really all one together.
And just the same thing is our language, the words we use, the vocabulary for which we use and seek to understand. Because a lack of understanding brings about fear. And without having clear communication, without, I think, I'll just say, in many cases, I think sometimes our media will take something and report on only a portion of it, which can advocate and certainly bring about fear in your walk, in your life, or with your children and going to school. It's best to be able to get to the total level of understanding and be able to get to the facts, very similar to what Mary said. Yeah.
Thank you for sharing, and I do want to comment, just a reminder that this is the audience participation part of our session. I do see a microphone there. I'm going to respond to our panelists, but just in case you're interested, feel free to step up to the mic and then I'll call on you. And I promise that we'll end on time, but I just want to continue with the dialogue. Your commentary, Mary, Garr, Mary Beth, Claude. So just adding the conundrum of what we experienced on this ongoing pandemic is not just the pandemic, the virus, but also the information or misinformation and what a number of us call the infodemic. And so we are required in our public health framework to communicate effectively in order to inform and educate. So we're trying to become more creative with getting the right information in the right packaging in the right places at the right times. So your comment about being cognizant of that, whether it's the digital divide or making sure that we deputize trusted sources on the ground to share the information, regardless of where one lands, but recognizing that it is about getting the right information to make that best decision. The other is the importance of being in community. So making sure that we are in partnership. You are esteemed partners to the work that happens here in the city. But at the end of the day, we're going through this shared experience, this disruption that's impacting all our lives. So appreciate your comment around health literacy or illiteracy and what we could do a little differently as one of the areas of need. Looking to see if anyone is stepping up, but let me just say that I have another question for our panelists, as I see one person stepping up. So, did you want to go ahead?
Yes. Hi, I know them very well. My name's Rosemary Williams. I'm also a community health worker in the city of San Antonio, primarily working on the east side. And my question is, what I run into a lot is the stigma with mental health. I know myself growing up, it was never talked about in my household. Because if you had to really go see somebody, my dad was like, I can tell you what's wrong with you, you don't have to pay somebody to do that. And so, talk a little bit about the stigma that we see, and we try to educate in the community, but sometimes that's a tough discussion and it takes many conversations. So can you talk a little bit about that?
I'll start out, Rosemary, thank you for that, bringing that up. There are many different groups within our city. We are all one city, but the way in which we communicate in different sectors is different for some. In many cases, the matriarch of the family is who's looked to as the person to say, yes, it's okay to go seek counseling services or just have a conversation if we change our vocabulary. In some cases, if it's like my family, it's put on your bootstraps and get up and go. And, it'll all work its way out. I think gradually, at least I've seen in the last few decades that is getting better. In some cases, it's our young generations that are making that better because they do see they've experienced trauma and so forth. But I think we have to be very, very cognizant of, depending upon where we come from across the nation, that we are very intentional with the best way to message to different sectors within our community. It may be the church, it may be the place or the faith institution that we attend as well.
So I would say, again, it goes to trust, it goes to culture, it goes to what families and communities are comfortable with saying or doing. As you heard, I'm retired Army, and in the veterans, in the military culture, you weren't allowed to display weakness, right? Even today, we still say that because there's a fear of being weak, fear it'll affect your career, families couldn't speak up. So we have a lot of mental health challenges in the military, and service members and families die sadly every year because they will not deal with that. And it's not just mental health, there's stigmas even with physical health and trying to address those needs. So, that's one culture. And then, you think about San Antonio, and I'm from San Antonio, and I've been stationed in El Paso, which is even more heavily Hispanic. And so when you think of the Hispanic culture, and, where do you go to seek health care? It might be the curandero, as opposed to going to a hospital, because one, hospitals could be authoritarian and, or a stigmatizing place, and it's not where you go up the street, or again, you're not allowed to show that sign of weakness, with machismo. There's all sorts of cultural things to work on overcoming in that regard. And then frankly, again, people have access. Do they even know where to go for care? Can they afford care? Mental health has not been appropriately supported in terms of reimbursement, as we all know. Even still today, physical, we talk about, I'll just throw this statistic out, 60% of our health care costs are borne by employer insurance, which means if you are not employed by somebody that's offering you health insurance, then you may not have health insurance. And even if you do have health insurance, we have people who are functionally uninsured because they can't afford the deductibles and the co-pays, and too often then we still don't have mental health as a strong piece of that. So we struggle already to make access to mental health services available, and people don't understand where to go or what levels. And as you all know too, there's lots of ways to be considered a mental health professional. There's lots of tiers and who can and who can't be and what all does it mean. And when healthcare is already so complex, it's very challenging for folks that are dealing with a healthcare issue right now. And as you know, with physical health or mental health, a lot of times we don't think about it until the need is there, and that's the time you're most vulnerable and struggling to figure out where to go and how to seek help, and it's really not always there for you.
Great points, thank you.
Just acknowledging the question, I would also add, it's an opportunity to have these conversations in safe spaces that are non-traditional. Again, my public health journey has brought me from Illinois to Maryland to Massachusetts and now here in Texas. And I would say that for the brothers in the crowd, so basketball courts, barber shops, Bible study, bowling alleys, it's all about the bees. And I do barbecues. So it's just making sure that you identify non-traditional spaces to also have these conversations. Again, strips away the veneer of stigma, but it's also deputizing community health workers and ambassadors who can at least translate and convey the information in a way that folks feel whole. So just acknowledging that we're not creative enough, and at times I find that there's an opportunity, especially in the midst of chaos, to come up with new solutions.
Absolutely, and if you remember the slide that I showed, where does health really happen? Most of the time, it's not in a hospital or in a clinic. It's out in the community and in the homes and the schools and the workplaces. So if we're cognizant of that, that helps us to understand and think about where can we provide those supports to meet these needs.
Thank you.
You're welcome. So we have time for one more question. I'll ask it. And then we're going to wrap up, only because we know that you have time to transition. So to our speakers, one last, in just really 30 to 60 seconds, what do you feel would be some innovative practices to continue to build resilience in community? And I'll start with Mary Beth.
Absolutely. I think community is the key word. Meeting people where they are, wherever that is, as Claude, you so eloquently shared. Is that a barbecue? Is that at a church picnic? Where exactly is that at? Is it the flea market, right? Going where people are, providing them that service and alleviating fears will also bring down the stigma, but making sure that we're identifying who is the person that everyone is looking to in our communities across, whether that's the pastor, whether that's the priest, whether that's the matriarch, whatever that is, and getting those people in the room and going to them.
Just a quick nutshell, again, I agree, community, families, individuals. If we want to have thriving, vibrant, healthy communities, that means we have to have thriving, healthy families, and that means thriving, healthy individuals. So we all have to work at all levels. We need to cross communities. San Antonio is a very segregated city on a lot of levels, and how do we overcome that? You could drive from one part of San Antonio to another part and you think you're in a different country. We've got to find ways to come together collectively to be able to support each other. We have a lot of wonderful things about our city and county, a lot of strengths. We're known as a family-oriented community, but we also, don't always work well together. So it's crossing those silos, tearing down those silos, and coming together to find ways to address these community needs, which are really family needs, which are individual needs. And it's crossing those sectors and those barriers in people's lives to find ways of how do we create better opportunity for each other and support each other in this life journey.
Thank you for those comments. Again, this session was on the collective traumatic impact of COVID-19 on our community, so I'd like to thank our esteemed panelists. Give them a round of applause. We had a wonderful session. Just a reminder that to please complete your evaluations, your post-session survey evaluations. We appreciate the time that you spent this afternoon. We heard a lot this afternoon. The letter V comes to mind, just the last note. We've been hearing about this virus, these variants. We've been hearing about vulnerable populations, again, especially those who are going through this lived experience. We're talking about vaccine, whether one believes in it or not. But at the end of the day, we remain vigilant, and we're all in this as a shared members of a village. And so We bid you well, enjoy the rest of the conference, and again, let's thank our wonderful panelists.